I'm most passionate about being a hospice nurse is having families understand that death can be a beautiful thing, just like birth. It may not be the optimal time for death. It may not be what you planned on for your life, but it's here. It's going to happen, and it can be beautiful. And I think when I spend time with families and patients and allow them to understand that death is not scary and they can come together as a unit, then I've done my job. And when that patient does pass and take their last breath here and their next breath in their healthy self again, and the peace that I can visually see the family exhale, then I've done my job. I've done my job. I envision myself teaching the community and the layperson that hospice is not a dirty word. Death is not a dirty word. I want to teach individuals that haven't yet been faced with death of a loved one, themselves, or a friend, that hospice can be a very positive institution within your life, that it can support you emotionally and physically and medically so that you don't have to spend hours at the doctor going through tests. Let us manage those controls, those symptoms, so that you can be peaceful. And I want to teach the community and the lay person that the quicker someone gets into hospice, the more support that the patient is going to have and the more support that family is going to have. Most of the time, the patient's not the one that needs the support. It's the families. And that's one of the things that we do best is support. That is one of the most important things, is to give them permission. That patient needs to know that everything's going to be okay. And when they're imminent, I have to tell the families, death is here. You need to decide, do you want them to die worried about you? Or do you want them to die peacefully knowing that you're going to be okay? I think the most positive changes I would like to make in our community is to teach people that hospice is not an imminent death within 5 to 7 days. Hospice is something that can support you for months, sometimes years, and give you the comfort and the symptom control of pain and respiratory distress, but allow you the best quality of life versus that quantity of life. Hospice is about quality. I am about quality. I want you to go to that wedding, to that fishing trip. And if I can help our community understand that death is not scary, then that's what I would like to do.